woman has a head almost too small for intellect, but just big enough for love. Charles Meigs.
She is a woman because she owns 2 ovaries, giving her sex and personality. Instead, therefore, of womb man, she ought to be called ovary man. Dr. William Goodell.
It was as if the Almighty, in creating the female sex, had taken the uterus and built up a woman around it. Professor M.L. Holbrook.
We've emerged from the darkness of ignorance to a dawn of enlightenment. We've discarded our corsets and disproved the cliches. And while each victory is cause for celebration, it is also a catalyst to continue the struggle.
A group of us got together and started talking about what it would take to get people focused on the field of OBGYN. Several themes developed. One of them was that women were not in clinical trials. And in 1985, NIH had published a document stating that women should be included in clinical trials. And it was not actualizing that policy. And that's what actually generated the formation of the Society for Women's Health Research.
How did we know that research that was done primarily on young, white, healthy males could be extrapolated to women? And for whatever reason, nobody seemed to have asked that question before. So our first focus really was raising awareness about that and changing the policies at the Food and Drug Administration and the National Institutes of Health, and then in private industry, to include women and minorities in clinical trials.
The concerted effort of this society are hastening the day when women will be studied equally and as women, not neglected, written off as soft men, and that is cause to applaud.
We worked with the Congressional Caucus on Women's Issues, which was then on the Hill, and with certain members of Congress to write a letter actually to the GAO, the Government Accountability Office, to investigate the NIH to see if they were following their mandate. And of course, the answer was no.
1993, Congress passes NIH Revitalization Act with input from SWHR. It mandates that women and minorities be included in all clinical research and requires that Phase 3 clinical trials be analyzed by sex.
1996. The Society submits a proposal to the Institute of Medicine to validate the concept of sex-based biology and chart a direction for future research.
After considering the data and examples presented in this report, the committee expects that the public, scientific, and policy communities alike will agree that the understanding of sex differences in health and illness merits serious scientific inquiry in all aspects of biological and health-related research. It notes that, and I quote again, "Every cell has a sex," end quote. Thus, we need to begin at the biochemical and cellular level, and that it is necessary to study sex differences, quote, "from womb to tomb," end quote.
Men and women may have been created equal, but we were not created alike. Our brains, our hearts work differently.
We're going to start discussing men's brains, women's brains, and how they're very different from each other. Now, I want to start with men's brains. All right? Now, men's brains are very unique. Men's brains are made up of little boxes. And we have a box for everything. We've got a box for the car. We got a box for the money. We got a box for the job. We got a box for you. We got a box for the kids. We got boxes everywhere. And the rule is the boxes don't touch. When a man discusses a particular subject, we go to that particular box. We pull that box out. We open the box. We discuss only what is in that box. Now, women's brains are very, very different from men's brains. Women's brains are made up of a big ball of wire. and everything is connected to everything. And it's all driven by energy that we call emotion. It's just, it's one of the reasons why women tend to remember everything.
What we have found regarding the brain and the difference between men and women is that men's brains are bigger. 10% bigger on average. But if the old adage ever applied, it does apply here that size doesn't matter, because women tend to have more of what are called neurons, or the cells that actually do the hard work in the brain. So despite the fact that the men's brains are bigger, they're less dense. And women are more dense, but in the best sense of the word.
In 2002, SWHR launched its first interdisciplinary research network to study the sex differences in brain. And this network, through its collaborative efforts, published a book entitled Sex Differences in the Brain, From Genes to Behavior. The members of the Brain Network were also the founding members of the Organization for Study of Sex Differences, or OSSD, which was founded in collaboration with the Society in 2006.
There really is a difference between men and women's brains. We can see specific brain regions where there are structures that are larger in one sex than the other, have more cells devoted to certain functions. The difference is that we all think about attitudes and ways in which men and women interact has a lot to do with our social training.
If you're imagining a 3D image and you want to rotate that image in your head, just so you could see all the various facets of it, flip it around this way, flip it around that way, around. Men are better at that, as a general rule. Obviously not across the board, but men are better at that. Women are much better at taking lots of different tasks and somehow organizing them.
Brain is not the only area where there are major biological differences between women and men.
I'm permanently disabled. I was having heart attacks that whole 2 weeks. And if I had been a male, they would have done a cardiac workup. I mean, even if I was younger than 34, maybe 25, and with the same symptoms that I had, they would have done it. But being a female, they don't recognize, they don't recognize the heart as being a problem.
Since early 1990s, there has been an increased awareness of the impact of heart disease in women. We also know that heart disease impacts women differently than men. Even though there is an increased awareness, heart disease is still the #1 killer of women.
Well, the wake-up call was in 1984. The lines crossed for female mortality, demonstrating that every year since 1984, more women actually die of cardiovascular disease than men, and that through the 1990s, the gap had continued to widen. This 20-year campaign to include women in clinical trials, as well as to harness sex-only trials, meaning trials in cardiovascular disease that only enrolled women, to understand that unique physiology. We have already seen a payoff where women were much more likely than men to die with cardiovascular disease. That gap is now finally starting to narrow.
It is important to identify risk factors unique to women, and our cardiovascular interdisciplinary research network has been focused on this aspect. In fact, SWHR is hosting a scientific conference on October 7th and 8th in North Carolina, examining various unique risk factors in women beyond the traditional risk factors. I would like to thank the members of our network and our participants of the roundtables who have made our program successful. I would also like to thank our supporters for making our programs possible. Thank you very much.
Well, I think you've seen from the video that it's been an interesting, frustrating, fun, and exciting 25 years. And we're especially excited about the past year, when we've had some considerable success working closely with the Food and Drug Administration and also with the new policies at the NIH.
Last week, the National Institutes of Health announced that it is requiring scientists to test their work on both male and female animals. Now you're saying it will make a difference because now female and male subjects will have to be part of the testing.
Absolutely, and the female animal models and the female cells will have to be used in the studies where we're testing drugs to see if they might be effective.
And scientists will go along with this?
Well, as I said, it's taken 25 years to get to this point. I don't think it's a slam dunk. I think it's going to take a while. I mean, you asked the question, what was the resistance? I think part of it was just understanding that this is important and that there are differences. But female animals turned out to be more expensive than male. Male rats and mammals are less expensive than female. And it's more complicated and probably more expensive to be able to do research on both as opposed to one. So I think there's going to be, there are some complications, and it will take a while for the change to occur.
We're at a tremendously exciting time in terms of the possibility of making major advances in our understanding of these diseases and coming up with new treatments. But I'm absolutely convinced that it's only going to happen through a real collaboration between government scientists, between academic scientists, and between industry scientists, all working together to tackle these devastating diseases. And in that light, I think it's tremendous what the Society for Women's Health Research does in terms of helping with the advocacy, helping with the research, and helping with, advancing the cause so that all these entities can come together and work on a common goal.
But clearly, there's more to do. We're still looking at sex differences research in sleep disorders, in Alzheimer's disease, in neurological conditions. And we're also hoping to focus in the future on mental health disorders as well as sex differences in pain. We're also looking to the future to develop fellowships, and we're working with a number of universities to insert sex differences research into medical school curriculum. And I especially want to thank you, the audience. Some of you have been with us from the very beginning, not knowing what sex differences research was anyway. And some of you, of course, are here with us for the first time this evening. I hope you understand the importance of our work, and I hope you'll continue to support us. I thank you very much, and I appreciate all your help.
When asked what we're going to do in the future, you always have to think of Alan Kay's statement that the best way to predict the future is to invent it. And that's exactly what we're going to do.